Many thanks, Mr Deputy Speaker, and I'd like to firstly congratulate the Honourable Member for East Renfrewshire for bringing about this extremely important debate, and particularly at this time. Given time pressures, I will focus upon the humanitarian situation in Yemen. Recent figures reported by the United Nations indicate that the conflict has claimed 2,795 civilian lives in 2015, and that there have been thousands more casualties. Nearly 1.5 million people have also been displaced by the conflict, and many thousands may die due to malnutrition and the impact of the humanitarian crisis. Even before the conflict, Yemen was the poorest country in the Arab world. Poor governance, human development indicators and rapid population growth meant that millions of people were suffering greatly and already experiencing issues of poverty and hunger. The country is now experiencing significant humanitarian crisis, and it is reported that more than 80% of the population are in need of humanitarian aid. This equates to approximately 21.1 million people, including nearly 10 million children. In Yemen, it is the civilians who are bearing the brunt of this conflict, with many public facilities damaged or destroyed. People have lost access to essential services, including clean water, sanitation, energy and medical services. It is reported that nearly 600 health facilities have closed, and as we have heard, hospitals have been hit. Food prices have soared, creating a desperate situation for millions of people, including particularly vulnerable groups of children. Of the 10 million affected children, nearly 8 million do not have enough to eat on a daily basis, and UNICEF estimates that 537,000 children, or 1 in 8 under 5s, are now at risk of severe acute malnutrition. Many children have been forced out of schools by the conflict, although there are differing figures quoted regarding the exact numbers of children who have been affected. It appears the number of children needing access to education may be around 2.9 to 3.4 million. Furthermore, with medical centres being shut down, diminishing supplies, children are also now at risk of dying from treatable diseases. This is in addition to the risk of death or injury from the conflict itself. Save the Children have reported that since the start of the conflict, at least 7 children have been killed or injured every day. In terms of human rights issues, it has also been highlighted that there has been a significant recent increase in the recruitment and use of children in conflict in Yemen. I have spoken in previous debates about the impact of children being used in combat. The effects of this are often felt long after their physical scars have healed, and it psychologically damages them for life. In addition, issues have also been highlighted with children, particularly refugee children, falling victim to human traffickers and being at risk of trauma, such as physical and sexual violence. As a country, we have heard Yemen relies on imports for the majority of its food and fuel supplies. The blockade has had a significant impact on the quantity of vital supplies that are able to enter the country. The unpredictable and dangerous situations that agency staff on the ground are having to work in has also severely impeded their ability to distribute crucial humanitarian supplies around the country to affected populations. I pay absolute tribute to the work of aid agencies in the area. There continues to be substantial obstacles, however, impeding the passage of essential goods into and around Yemen, and much more needs to be done to ensure that a humanitarian corridor is created. I want to focus on the need for increased diplomatic pressure towards all parties in the conflict to support UN efforts to find a political solution to the conflict. We must pressure those involved to comply with their obligations under international humanitarian law and to take all possible measures to protect civilians and ensure that humanitarian agencies are also given a safe space in which to operate. The UN declared Yemen a Level 3 crisis on the 1st of July, a category reserved for the most severe and large-scale humanitarian crises. We need to pressure all of those involved, ensure that humanitarian aid reaches vulnerable people, women, children, the disabled, those in need of medical aid, oxygen, and the population in general. I beseech the Minister to do all possible to pressure for ceasefire, independent inquiry, political solution, and to ensure that the ordinary civilians affected in Yemen, many helpless children, are protected and supported.
Hear, hear.